In this short video, I'm going to show some aspects of quantitative EMG. We will start with the triggering of the motor unit potential and then discuss recruitment firing analysis, multi-map analysis, and interference pattern analysis.
Well, first we had to introduce the patient ID and also the age or birthday, since that is necessary to obtain or to localize the correct reference values. Height and is necessary, weight is at the moment not necessary. And here we choose the muscle, and I'm going to investigate the extensor digitorum. We insert the needle. I holding the needle like a pen, and with a slight activation, I insert the needle. And in order to look at fibrillation potentials, we have to make sure that we are inside the muscle. So I ask the patient to activate a little so that we know that we are inside the muscle. And here I am in the muscle, and we move to a few different places, like in the side of the pyramid. And this patient is not supposed to have fibrillation potentials, so we can go over to the next step. And that is voluntary activity. We are going to ask for a very slight contraction. We trigger on the sweep so that you see the trigger level up to the upper right quadrant. And the trigger level is indicated with a yellow symbol. I move the needle to get a good signal, and here is just one motor unit that is active. In the lower right corner we look at the stability of the motor unit shape, and you see that on repetitive discharges it is quite stable. Here we have a motor unit potential that is triggered, and you see that it has a slight complexity, and you can see that there is a slight variability in the shape, which is normal in this muscle in the patient's age. So this is a way to look at the motor unit potentials individually, and I move the needle. And we can increase the gain in the lower right corner to see the signal displayed a little better. And that is the stability window, which shows the signal in a filtered form. We take away signals that are below 500 Hertz, and we can see the stability. So in general you see that the white lines there are quite okay, and one sees spurious triggers as well.
And then we start the recruitment analysis.
We ask the patient for a very slight contraction, and now a new motor unit is coming in. One can hear that in the background, and with increasing rate we see that the other motor unit now is coming in. And this is now, we have collected a few different motor units. And here is the result of the recruitment pattern analysis. First, the brown motor unit that came in at the frequency of 10 Hertz, that's called onset frequency, and with increasing frequency here, more strength, then we recruited another motor unit, the blue one at the bottom here, and then a little later a yellow one. And here is the interpretation. The recruitment frequency is equal to the frequency of the brown when the next one came in. So in this case 13.6. And the recruitment ratio is when we have a little higher force and we have one 2 3 motor units, and the highest frequency is 14.8 divided by 3 is 4.9, and that is the recruitment ratio. The white line here is the continuous plot of the recruitment ratio. And now we are going to do the multi-map analysis. I insert the needle into the muscle. We ask the patient for a very slight voluntary contraction and can obtain these signals. And you see how the memory boxes are filled up. There are 2 different units now, and we accept that. We press accept, and then a new recording position. Here are other motor units, and when we have enough, we accept that, and then I move the needle slightly and we get the new motor unit. We start the analysis. Here's a new position, and we accept this. These were 2 very similar units. Now we have 2 different units. We accept this, and then I move the needle a little, and we start the analysis again. Slightly different position. So then I move the needle again. Complex signal, and we accept this, and then we restart the analysis. New position, slight voluntary contraction, accept this, new position. We now have 16. Change the gain depending on whether it's overloaded or not, and accept this. New skin insertion, and then again we restart the analysis. Here's a new position. Accept. We start to analyze. And then we start to analyze again. Yes, some high amplitude, some low amplitude. Accept this one. And then we restart the analysis. We accept this one. And then we take new analysis. We run. And here is another unit. And now we have 33 motor units collected, and then we go over to the interference pattern, and I'm going to do that in short segments, and so start and stop after each second. So here is a slight contraction, and we analyze. And we stop the analysis and start, and I move the needle, analyze. I move the needle, analyze. I increase the strength. We ask the patient to increase the strength, and we analyze. New electrode position, and we start again. new skin insertion, light contraction, analyze, analyze, and then we analyze again. We analyze, different needle position for each time. Analyze, and now we have 20 dots, and you see that they are outside the normal limit. The green is the normal limit, so this is slightly neurogenic situation. Another way to do this analysis is to make a continuous analysis of each half second during continuous movement of the electrode. I can demonstrate that. We ask the patient for a slight contraction, and now we start analysis. And now it's continuous analysis going on here during the movement of the electrode all the time. And then we can stop here. Now we have 34 signals, and again that became neurogenic. Turns amplitude is not edited, but the multi-map is edited. And now we are going to edit the collected multi-map signals. And here is the display, and we have 30 collected motor unit potentials, and I want to remove those that are not acceptable for regarding quality and copies. I look at copies first. Here is a copy, and they are slightly different, so the computer has considered them as different, but I don't believe that. And so that happened to be a subjective thing. Here is a cursor setting that is erroneously long because of disturbance of the baseline. I remove that as well. The signal is removed, and here is the same thing. This signal is also erroneously set. Here is another. In this case, for example, we can either remove the signal, which I prefer, but we can also set the cursor manually. And when I press on the cursor, the amplitude goes up to 100 microvolt per division, so that all settings are made with a standard gain. Then this one is the same thing. I removed that one. This one is upside down, probably recorded mainly from the cannula, so I removed that. Here is some signals that have an abnormal cursor setting. This is acceptable, and here is acceptable, and here the start of this is questionable, but so we don't change that. And now we have 24 different accepted signals, and we can see the plot to the left here with duration on the x-axis and amplitude on the y-axis. And when I want to inspect a given motor unit for potential, for example this one, I press on this one, and it turns up here with colors. The red, the colored signals are recorded from the same insertional point, and the red one is representing the dot. And here I take this small signal, I press on that, and these are the 4 signals that we obtained, and this little one is the representing here. The normal values are for individual units in red, and the mean value is in blue, and then you see the mean value is outside, and also a number of individual motor unit potentials are outside the outlier limit. So this is a slight neurogenic situation, and we saw that also in the turns amplitude interference pattern analysis, that we got the neurogenic pattern. when I do the individual checking of the signals, I see them also displayed, all those that contribute to the averaged signal. So this was the end of the editing, and normally when I don't sit and demonstrate, it takes about half a minute to remove bad signals and exceptionally change the cursor setting and remove copies.
So you have seen some aspects of quantitative EMG. In my routine, I use this in nearly 100% of the patients, and usually in 70 to 100% of their studied muscles. The time for multi-map analysis and interference pattern takes 3 to 5 minutes, and editing adds another 30 seconds. Thank you for watching.